I want to give you a physician's perspective on the coronavirus, also known as COVID-19, that is crippling the country. First of all, I want you to be aware that most of the information you are hearing is from non-medical personnel and the rhetoric that is not factual. And I want to tell you what I believe is actually occurring and what will occur and how we can prevent any adverse effects. First of all, there are many metrics involved with this particular disease and situation, and many of them have a large political bias, but I want you all to be aware this is no particular party's fault. President Trump is not responsible for this virus or what is transpiring right now in the country. I believe he has taken the appropriate steps necessary to curtail this and to help the preservation of civilization. First of all, let me tell you, this is a virus supposedly from China. The fact that this is from China, which is a communist nation that obviously is not going to communicate well with us or any other nation or entity, makes it difficult to get the true facts and what exactly is occurring. China, I believe, is concealing a lot of information, and there's, even though they were trained by our CDC in this country, they are not telling us all the information that we needed, and we were not able to act as expeditiously as we wanted in terms of travel restrictions and curtailing the spread of this particular entity. I also want you to be aware that this is a virus, and primarily it's respiratory symptoms with coughing and a fever, and the same people that are going to get sick and succumb to this are the ones that would have problems with any type of virus. So I want you all to relax. I'm going to tell you what I think is going to occur and what we need to do to prevent this, and let us all get back to the quality of life that we expect. When I look at this particular virus or any illness, I look at the 80-20 rule. And what that means essentially is 80% of people are going to do fine. They're going to have no symptoms. They're going to be asymptomatic. They may be carriers, and yes, they could be shedding the virus, but they themselves are going to be fine. They could spread it to other people, and as long as they are fairly healthy without concomitant medical problems, I don't ensue any difficulty. I think the worst that can happen is the flu-like illness. This is a little different in terms of it's mainly a dry cough and a fever, and younger individuals are getting diarrhea with this, believe it or not. Anyway, the other 20%, and this is for any type of virus, we have to look back at the history, and even polio was a virus. The debilitated nursing home patients, cancer patients, immunocompromised patients that have HIV, those that fit that stratum that are higher risk are going to have more difficulties with this. And what happens with this particular virus or any virus or the flu, which kills many more people, is people develop pneumonia and develop what's called acute respiratory distress syndrome. And that's also known as non-cardiogenic pulmonary edema, where where there is fluid that builds up, and it does make difficult for the heart to pump efficaciously. So these are the main concerns, or the way this will present. And I will tell you the bottom line with the coronavirus, and I know we have all heard it before, is that this, essentially, it has been blown out of proportion. This has been labeled a pandemic by the World Health Organization. And what does a pandemic mean? That means this is around throughout the world. I think we have to remember, though, that that probably is a misnomer to an extent, because at this time of year, there are many viruses and flu and allergies and other infections that can, as I mentioned, skew this. So I have my doubts whether this really is a pandemic at this point. I think that because this is a novel and new entity, there is a lot we don't know about it. And I want to reassure you that if we take the precautions that all of us would do for any type of virus or infection in terms of utilizing meticulous hygienic practices, covering our coughs, and just trying to be vigilant and careful. I want to talk to you a second about the treatment of this. The treatment of this or any virus is essentially infection control. And we want to use, again, we want to utilize public health protocols. And the main thing that would accomplish is utilizing supportive or symptomatic measures. And we need to do what you would do with any type of virus, whether it's an upper respiratory infection, a viral gastroenteritis, which can affect the stomach with diarrhea and vomiting. We need to wash our hands. And a trick that I have learned in terms of hand washing, and what I have told my kids, we need to wash to the point where we are singing happy birthday twice. I think if that's done, we will be more effective in being as clean as possible and not spread any contaminants. I was also mentioned if someone is coughing, yes, they need to cover their cough and obviously then wash their hands. We should not, as you've heard, we should not touch our eyes, nose, or mouth for any reason. And I think what's exciting now is that we are now coming out with testing. Thermo Fisher and Roche have developed test kits where thousands of people can be tested at once instead of the 40 to 100 that were able to be tested antecedently. So what we will be testing is the SARS-CoV-2. And I want everybody to remember about the coronavirus. This is a virus that has been around probably for thousands of years, and we've all been exposed to it, even with simple upper respiratory infections and viruses. This is different because it's unknown and it came from a foreign country that is not revealing all the facts and information. So I think that's what makes us a little bit more. The treatment, we do not have a treatment at this point. There are investigational agents being looked at that we use for viruses such as HIV, but I think the key is to develop a vaccine. And we might be a month or two away from that, but I believe that will transpire very soon. The key is prevention and avoiding crowds. Now, the problem I have with the nation essentially being shut down is that I think it's going to lead to other difficulties. If we have people not working in the inner cities without having an income, there's going to be more looting and civil unrest. And if the kids not going to school, not only are they going to be deficient in their studying, but who's to say they're not going to go to a large urban area and transmit the virus and then bring it back and contaminate other people. So I think we have problems with the exact way we're treating it, which is a manifestation of public health protocol that we try to utilize regardless. And in terms of wearing a mask, unless the person is known to have the virus, then he should wear a mask. Otherwise, it's probably not necessary. People who cough can have the aerosolized droplets be. This is a virus that has been around for many, many years. I do believe that everybody will be okay. The people that are going to get sick are the ones that would get sick from any type of infection. That's usually the older, those with many medical conditions or comorbidities. So I want everybody to practice the hand washing and relax, and let's get back to society and our quality of life and defeat this entity and put this in the back burner. So I wish all of you good luck. If anybody has any questions at all, please comment below, and I will get back to you as expeditiously as possible.